You know what I want to do? I was told that I would never walk again by this doctor. So what I want to do is as soon as I can even get on a walker, I'm going to walk into that office and show them that I can.
And our guest on this episode of Sidewalk Talk is Dr. Josh Davis from First Step Physical Therapy. Doc, welcome to the program. Tell us your
Thank you so
story.
much.
What First Step Physical Therapy? Tell me the story behind it. Why First Step?
Absolutely. So, First Step Physical Therapy, we originated in the Atlanta area, and we specialize in the outpatient treatment of neurologic issues. And so, a lot of times you'll see, a lot of outpatient clinics, they're very orthopedic based, and in doing that, they see multiple patients an hour. You're running through, 2, 3, 4 patients an hour, and trying to get them, better orthopedically as quickly as possible. And what we've noticed is that with the neurologic population, it takes a little more of that one-on-one time with them. And sometimes it takes multiple hours of treatment to be able to get them to their functional goals. And so that's kind of the way that we have structured the whole First Step recovery model, doing all one-on-one physical therapy, one patient with one therapist for a full hour. And we'll do that for multiple hours if needed. And then being able to give them that undivided attention allows us to go through all of our 10 components that we try to put into each of our steps of the First Step recovery model.
So we got to know you through the Make Lemonade Foundation for Cerebral Palsy, and Sherry and Lauren were, I mean, they can't stop talking about you, right? So how does it, so is this physical therapy, it's this type of physical therapy, I know you call it neurologic rehab. Is this for Joe Blow that hurts his knee, and needs physical therapy? Or is it, people, working with cerebral palsy and trying to rehab in that manner? Which is it? Is it both? How does that work?
Yeah, so the great thing about the First Step recovery model is it's movement based, and so we break it down into 7 steps, starting at the top and working our way down the body. So if you're looking at step 1, you're talking about the head and neck, and seeing where the movement patterns are and how that movement is being initiated. And so we call that the driver. And so step 1 is just the head driver, and then we move down. Now you're moving down into the shoulder driver and getting everything moving in that region, not just the shoulder joints, but also the ribs that come into the sternum and the breastbone, and then around in the back to the vertebrae. And how is all the, not just the joints, but the soft tissue, everything in that region moving. And then going down into step 3, now you have to connect that in order to to progress in that functional movement. Now you have to progress from the shoulder driver, connect that to the arms, connect that to the pelvis to be able to get that full body motion. Then we look at the forearms and the hands, making sure that you're able to grip, grasp, pick up things, manipulate objects, going down into the pelvis, which is step 5, making sure that the pelvis is what's leading that motion, specifically in standing positions and with walking, making sure you're not leading with that head, or you're no longer a head driver or a shoulder driver, but now you're letting that pelvis be the leader and the initiator of the movement, and then everything else can be a passenger and go along for the ride with you. Once you maintain that pelvic driver, have that good core control, now you can move down into the hips, into the knees, and then last but not least, down into the ankles. And we have, our 10 components that we have in each step to be able to put into that. So to answer your question specifically, we designed the First Step recovery model to be able to progress neurologic patients, people with, nerve, spine, brain injuries, to be able to progress them a little bit quicker than what they were getting in normal outpatient settings. That being said, it can be placed onto an orthopedic patient. So, you go outside, you sprain your ankle. Now I'm looking down at that step 7 and saying, okay, I want to be an ankle driver. What techniques do I have to be able to improve the soft tissue in the area, the mobility of the joints in the area, to strengthen, to get neuromuscular reeducation, to get control, balance, that type of stuff. And we can put all of that into each individual step. Quite honestly, it's just easier with orthopedic patients because it's so specific to the neurologic population, which typically has more comorbidities and dysfunctions that are going on with that population.
So say someone even has, degenerative disc disease, that it's and along whatever thoracic, wherever they are in the spine, then would you start at step one and work someone like that through the process? How does that work?
Absolutely. And so each person is individualized. And so we would bring them in, look at where we're starting. Okay. And so if we would look and say, okay, what is their movement patterns, and where specifically is that going on? With more of an orthopedic patient, typically you wouldn't start at step one and work your way down through step 7. You would start wherever that dysfunction is, because typically that is where the beginning origins of the dysfunction begins. And so what you would, say you had a, degenerative disc, say you have sciatica of the lumbar spine, right? Coming out of that L4-5 region, going down into the back and, through the hip and down your leg, that shooting pain down the leg. We would look at that region and look at the movement patterns of the pelvis, and really see if you are able to, one, start with the posture, right? Make sure that nothing is compressing on that nerve in that region, the soft tissue, the joints, make sure everything has the mobility that it needs. And then being able to, once you look at the anatomy that's there, you look at the biomechanics of that anatomy, is it moving properly? Then you can start to coordinate and make sure that you have the coordination needed to make functional movements in everyday life without that pain, without the neuropathy, without the, sharp shooting going down the leg.
Did you get into this, you personally? I mean, well, before we even get to that, talk about Lauren while you're in her case and her situation. Um, you've seen her go from really struggling and to now ballroom dancing. Take me through her situation, and I know she's okay with us talking about it. She's
Absolutely.
talked
And
to us about it. She wants the world. She wants the world to know about it. Again, a plug for them, the Make Lemonade Foundation. Great foundation, Make Lemonade Foundation for Cerebral Palsy. You can check them out online at makelemonade.org. And it's an interesting story. Her story alone. I mean, obviously she's a strong woman now, right? But take me
absolutely.
through her story and why they can't stop talking about you and trying to tell the world if they need help to come and see you.
Well, Lauren has an awesome, awesome story, right? I met Lauren about 10 years ago, at First Step Physical Therapy down in Fayetteville, Georgia, in just south of Atlanta. And they came in. She was, she was diagnosed with cerebral palsy. She was, going to school full time, but was in a wheelchair because she was afraid that, she was having multiple falls a day. With especially trying to get around in middle school with a book bag and kids walking through the hallways, knocking you over, that kind of thing. So she was, in a wheelchair full time. And then, just sitting down with her, going through, okay, what are your goals? We were able to progress her from a wheelchair to a posterior walker to bilateral cane. So canes on both sides or forearm crutches. And then we were able to get that down to one cane. Then we're able to start the walking patterns and going through that step 5, 6, 7, and getting the pelvic driver, getting the hip and knee driver, getting that ankle driver started. And then once you are able to do that, she's able to progress from the wheelchair to the walker to the 2 canes to the 1 cane, and then being able to walk without anything, right? And having that good balance, and then eventually progressing to athletics, right? Being able to, that she's able to do ballroom dancing, which is an amazing story. And I mean, one thing for people to know, it doesn't happen overnight, and it does take work. It takes work on our part. It takes work on their part. But if they're willing to put that time in, and willing to give us the time that's needed, you can see amazing progress functionally.
So let's not talk as a doctor. Although doctors are humans, I want you to talk as a human. Tell me how, when you see cases like Lauren and situations like Lauren, tell me how that makes you feel.
Oh, great. I'll tell you, we have our Facebook page, we have our Instagram page, and I have friends from college and from growing up, and then my parents' friends, and they'll come up to me and they're like, "Man, you have an awesome job." I was like, "I actually do." One, I love what I do. Two, I like training other people to love what we do, and then three, we get to see people get better, right? We get to see people who are down and out, who, I mean, and really a lot of the, especially the neurologic population, they've been told for years that, that this is as far as they're going to be, right? That functionally you're going to be in this wheelchair, that this is what's going to be best for you. And then what you start to see is, if you're sitting in a wheelchair all day long, guess what happens? You start to develop these orthopedic problems as well. So now you start to get that back pain. Your hips start to tighten up. Your ankles and knees, they start to tighten up because you've been in that flex position for so long. And so by the time, they come to us, now we can start making really fast progress just by getting those orthopedic issues out of the way, and then start to address some of the neurologic, the coordination, the biomechanics, that kind of thing. But yeah, it's an awesome job, and it's a pleasure for us at First Step to be able to provide that to the community.
Why in the past, until recently, have those patients been told, this is it, you're in a wheelchair and that's the best it's going to get for you? Why is it only happening now that we can figure out there's better than that?
That's a good question. An excellent question, actually, because it's one of those things I've wondered for 10, 15 years, since I've been working specifically with this, or with the neurologic population. And we'd see spinal cord patients that would come into us. We'd see, kids with cerebral palsy that would come into us that, either when they were injured or during their physical therapy that they had when they were younger, they were told by either a physical therapist, by a physician, by someone that you're not going to get better because these types of things don't get better. And it's one of those things that, we're treating these types of patients in the clinic and we're seeing them get better. And I can't tell you how many patients we've had that like, what I want to do? I was told that I would never walk again by this doctor. So what I want to do is, as soon as I can even get on a walker, I'm going to walk into that office and show them that I can. And what we started to see was that we'd get a little change in diagnosis. We'd get a change from a complete spinal cord injury to an incomplete spinal cord injury, or maybe they weren't as injured as we thought. But either way, whatever that reasoning is, I do think the research is starting to catch up with what we have believed for 10, 15 years now. You're starting to see more and more research on the neuroregeneration of the brain, of the spinal cord, of the peripheral nerves, that all of these things can improve as long as they're provided the proper environment to do that we're getting the proper blood flow into those areas. And so you're starting to see more and more research on it now recently, which is awesome. And I think a lot of that has to do with the population getting older. You start to see a lot more research on the dementia, the Alzheimer's. What can we do to help one, prevent, and then two, treat once we get to that region? And what we're seeing is that it is a blood flow issue, right? We want to get that good blood in there, the oxygenated blood, into and around the nerves to be able for them to regenerate.
All right. So can you give me an example of that, and how do you go about getting the good blood flow into that area? Like, for example, you sprain your ankle. The was always ice it, keep it elevated at the beginning. But now we're hearing conflicting things, that you still ice it, but then you want to put heat onto it because heat generates blood flow. Is that the same idea that you're talking about in a much more important
Yeah,
capacity?
absolutely. And so that's what you see as you're talking more from an athletic perspective and less from a rehabilitation perspective, but the idea is the same. So what you're looking at is, yes, you want, during the initial injury, right, phase, the acute phase is what we call it, but you want to get the inflammation down. You want to do everything you can to reduce the inflammation in that area, to reduce the cell damage that's going on in that area. And now what we're seeing with the research is right after that phase, we want to start getting active, right? And from an athletics perspective, like you were saying, you want to get a little heat in there to loosen up the soft tissue in the area. But not just that, but start some active range of motion earlier and earlier in the rehab process. And what that activity does is improves blood flow into the area, because that's what we need to heal. We're, just from an injury perspective, if we want something to heal, right? Say we have a wound, say we have an ankle sprain, whatever that is, you have to get good blood flow into that area for it to heal. And what we're seeing with a lot of the folks that it just didn't happen for early on is because they were placed in a wheelchair, right? They were put in a position where they would tighten up. Their soft tissue would tighten up, the connective tissue would tighten up, the joints themselves would tighten up. And guess what? If you're in a seated position and you're in that 90 degrees or more of hip flexion sitting in a wheelchair, you're not going to get good blood flow down into your feet. And so that's where you start to see swelling and pooling and larger feet, larger lower legs than what you would normally get if you were up, standing, moving around, walking, pumping some of that inflammation back out.
So same idea for someone with a neurologic disorder, same
Absolutely.
concept. And then so someone presents, then you work them through the 10 steps. Is that what the part of the point of the 10 steps is, to get the blood flow going?
Absolutely. When you're talking from a healing perspective, because we have like the manual physical therapy, that's just loosening up either soft tissue, connective tissue, or joints using the hands. That's what manual means. We have the therapeutic exercise steps. So you're looking specifically at which of the 7 steps they are in and putting those specific exercise into that, right? Either to stretch or to strengthen or to improve blood flow coordination in that area. Right, neuromuscular reeducation, being able to coordinate between different parts of the body and movement. We actually have sensation recovery, where we're trying to stimulate the sensory receptors. Right, if you have a neurologic issue, you have the burning, the tingling, or the numbness. You see it in neuropathies. You see it with different other peripheral nerve, sciatica, that kind of stuff. But really being able to stimulate the receptors in this area specifically, because we have vibratory receptors in the area, you have light touch, you have deep pressure, and being able to stimulate all of these things to improve and really getting as much blood flowing into that area, into where those receptors are. You can start to see some sensation recovery in there too.
So I'm a big believer, and it's okay if you disagree with me. I know we're here to be authentic. I'm a big believer that the mental part of recovery in any situation and healing is just tremendously important. So positivity breeds positivity, which leads to success. There are some things that you can't overcome. If someone loses a leg, another one's not going to grow back. But whether it's autoimmune diseases, I really believe that if we're in the right mental capacity and have the will, that our bodies are miracles in healing. I look at Lauren, and she's just a mentally strong individual, which obviously led her to success, and she had great surroundings and great care. And that obviously has helped her. But what do you say about how much of a role does the mental approach to neurological rehab, how much of a role does mental play in that?
Oh, it's huge. And this is coming from a physical therapist, right? So I'm looking at the physical side of things. But one of our components in the first step recovery model is cognitive rehab therapy. And so cognitive meaning looking at the brain, not just what you're thinking, but how you're thinking and what you do to prep for movement. And studies have shown that if we sit down and we use imagery in a functional movement, right? I can imagine myself moving in this way, that it does have some carryover into what we're actually physically able to do. So putting those types of things into, you have someone who wants to be able to walk and they have the capacity to stand, but they don't have the coordination yet to be able to get that movement pattern. Getting them on something, we have a machine called the gait patterning machine, where you're laying on your back, but it's taking you through that walking cycle, or even being able to stand and unweight them enough. But prior to that physical activity, actually having the imagery and going through that motions and being very specific with what we're thinking about, and like you said, being positive about it, right? It has shown some really good carryover into functional movement, not just in rehab, but also in athletics. I know a lot of times you'll hear, baseball players, football players, golfers going through every hole, every stroke, every hit, every play of a football game prior to actually going through and doing the plays, because psychologically it has shown some benefits physically.
Yeah, no doubt. I've heard, you can literally, a baseball player can visualize where they're going to hit the ball. Just like even in business, people doing presentations can visualize and hear that presentation before they give it. It's the same idea. You think about it and it can happen. I'd like to talk to you about, you're a doctor in physical therapy. People go see physical therapists. Those that they're not doctors, they're physical therapists. So you're a doctor of physical therapy. When did that come about? When did we start in house? So explain the difference between physical therapist and that you're a doctor of physical therapy.
Sure. About 20 years ago, the physical therapy profession made the decision to start moving towards away from the master's degree into a doctoral degree. Okay. And different for all schools, that another year you're looking at, or another semester, whatever the case be there, but you're looking at the physical therapy wanting to be autonomous and wanting to be able to provide physical therapy in a direct access format for patients, meaning that you would, if you're at home, you walk out, you sprain your ankle, you're able to come straight into the physical therapist without first having to go through the physician as a middleman, especially for things like that. Now, in order to do that, the physical therapist needed extra training. You have to be able to differentially diagnose things and know what you would be able to treat and what you need to refer back out for. And so that's really what a lot of that process was over the past, 10 years. I believe every physical therapy school in the country has transitioned into the doctoral program, is really putting that differential diagnosis, being able to know, okay, yes, this is appropriate physical therapy. Ooh, that's that is some sort of, you have an active infection going on, right? Which can cause pain. And so you come in with back pain. I noticed that you have an active infection going on. I don't treat infection, right? I treat movement patterns. I treat disability. I can get the inflammation down, but if it's infected, guess what? I need to refer you back out to the physician to be able to prescribe you the proper medication to be able to get that infection level down. Then you could come back to me for the movement and to reduce inflammation and to get you back to where you can, be more functionally active than what you were previously.
I think we may have had some visual problems. The audio seemed good to me. So if people are watching on YouTube, they may have noticed a frozen screen, but you seem to be clear now. I also noticed behind you Georgia Bulldogs gear, defending national champs in football. Did you graduate? Are you a big Georgia Bulldogs fan? I'm guessing. Did you graduate from University of Georgia? Or
Absolutely. Yeah. So I grew up a Georgia Bulldog. Both of my parents graduated from the University of Georgia there. My brother went there, grew up going to all the football games. I know it's a very similar experience that the folks around the Buffalo get the Bills, right? You go into these games for the Sabres, right? You grow up going there, you go with your parents, you have the nostalgia, and then you do that with your kids now. I have two little kids. I have an 8 and a 6-year-old boy. We just went to the Georgia game this past weekend. My wife and I were at the national championship game. So yeah, we've been big Georgia fans for years and years. I graduated from the University of Georgia back in 2002. So that's where I have a strong love for the University of Georgia. Absolutely.
yeah. So Doc is out in Georgia, obviously. Shovel Sidewalk is, we're here in Buffalo. And part of that connection, as I mentioned earlier, is through the Make Lemonade Foundation for Cerebral Palsy. But Doc, you now have an office, a location here in Buffalo. So you're in 2 locations. So congratulations on heading north as well. And this will be, I'm assuming, your first winter here. So enjoy that. But why Buffalo?
Like you said, it's through the Make Lemonade Foundation. That's where with Lauren and Sherry, they started the Make Lemonade Foundation. They wanted to be able to provide the type of physical therapy through the First Step recovery model that we do to other kids and adults with cerebral palsy. And so what Sherry and her husband Peter are originally from the Buffalo area. And so they've done a lot of fundraising in that area and really built up a strong community of people with cerebral palsy in the area, to support each other. And it's been great to see. And so one of the things they did to help support is they would send down kids and adults with cerebral palsy to the Atlanta area, to one of our clinics in the Atlanta area, to get intensive treatment for 1 week. And so they'd come in, they'd do 5 hours a day, 5 days a week. They'd get 25 hours. They'd go home with a stack of home, not just exercises, but other coordination, manual techniques, that type of stuff that either their physical therapist can do with them, that the parents can help the kids do at home. And one of the things that we kept getting feedback from was the parents really wanted us to be able to train a physical therapist in the Buffalo area so that they could get ongoing physical therapy through the First Step recovery model throughout the year. So it's not just a one-time come down for the year, or even 2 or 3 times, but that they were able to get that ongoing therapy right there at home. So over the past couple of years, that's been a goal of mine, be able to find the right person that would be willing to come down, train with us in the Atlanta area multiple times. I would go up, help train them physically on site, and then really get everybody on the same page and really be able to bring that First Step recovery model to Western New York. So yeah, we actually were in a temporary space since July. So we opened July 5th. We're able to start treating some patients. We rented a room out of the Motion Project, and we're there until about 2 weeks ago. We moved into our permanent space right on Walden Avenue in Cheektowaga. So we are, very excited to get this next step, of First Step going in Buffalo.
It's awesome. Congratulations, Doc. And in Buffalo, it's July, not July. That's okay.
Yeah, it's
That's
great.
okay.
I'm told that I have a bit of an accent when I'm in Buffalo.
That's
yeah.
all right. Yeah, well, you'll get used to it. I think it's great. I think it's cool. We can feel your passion, appreciate the passion and the rationale behind your work, or the process that you go through, and the willingness to I guess approach things a little bit differently. And I guess it would be to not give up, right? It's about not giving up on patients, and trying to do something, I guess, different than what we're used to seeing. Is that what that would be?
Absolutely. Yeah. It's one of those things, never give up. Right. And you want to be as functional and pain-free, and be able to do as much in your everyday life as you can physically do. It's like you said, there are limits, right? If your leg's cut off, guess what? You're not growing another leg, but you want to be as functional as you can with that. And it's the same thing with any neurologic dysfunction or disease or anything, right? You want to be as functional and as active throughout your life as possible.
Cool. He's Dr. Josh Davis. It's First Step Physical Therapy down in Georgia, and now up here in Buffalo as well. You check him out at firststeppt.com. That is firststeppt.com. Dr. Davis, appreciate you. And thanks for joining us here on Sidewalk Talk.
Absolutely. Thank you very much.
If you have a story yourself that you want to share, or somebody that has a passion and want to just use this platform to help get your message out, that's what we're here for. Check out our website, shovelthesidewalk.com. leave the information. We'll get back to you and put you on a future episode. Thanks for listening or watching. I'm Steve Fortunato, and this has been Sidewalk Talk.